This is Dr. Jeff Wasserman with Lake Point Orthopedics and Sports Medicine with offices throughout the Dallas, Texas area. This video will discuss the diagnosis and treatment of thoracic and lumbar spine compression fractures. These are quite common in elderly people with osteoporosis, with or without a previous history of a fall or obvious trauma. A spine compression fracture happens when one of the bones in your spine, called a vertebra, collapses or is compressed. When a fracture happens, the shape of the vertebra changes, often becoming shorter or flatter. Think of it like a piece of chalk that gets squeezed too hard and cracks. These usually occur in the mid or lower back. The fractures usually occur after a fall, car accident, or any sudden impact on the back. These fractures are also more likely to happen if there was a pre-existing condition that weakened the bone, like osteoporosis. Osteoporosis is a condition usually found in elderly people or those who routinely take steroids. Certain tumors that grow within the vertebral bone or metastasize to the spine may also weaken the bone and cause compression fractures. These fractures can lead to severe back pain, difficulty standing up straight, and a hunched posture when several bones are affected. Some people may recover with rest, back bracing, physical therapy, and medications. The good news is that for those who do not respond to conservative therapy, or suffer from debilitating back pain, and cannot wait for conservative measures to work, there are very effective and safe, minimally invasive procedures available to treat this problem. Although X-rays and CT scans can sometimes be helpful, the gold standard method for diagnosing vertebral compression fractures is magnetic resonance imaging, known as MRI scan. Bone scans are sometimes utilized as well if MRI is contraindicated, such as in a person with an implanted defibrillator in place. A DEXA scan may be obtained to confirm if the person has osteoporosis, so that treatment for this can be addressed as well. On MRI scan, the fractured vertebra will contain characteristic grayscale color changes depending on the specific pulse sequence, as illustrated here on the right. Collapse of the fractured vertebra will also be noted. If back bracing, physical therapy, and pain medications fail to provide adequate relief, or if a person is severely debilitated by pain, a kyphoplasty procedure is often recommended. During the procedure, we insert a thin tube towards the affected area. Through this tube, we insert a special balloon into the fractured vertebra and gently inflate it. Each vertebra may require a second balloon placed from the opposite side. This helps restore the bone to a more natural shape and creates a space inside the bone. On occasion, we choose not to use a balloon before injecting the cement directly into the fractured vertebra. This procedure is called vertebroplasty, and often chosen if there is some collapsed bone into the spinal canal, or the procedure is done for tumor metastasis to the vertebra. Once we've made that space, we fill it with medical cement. The cement hardens quickly and stabilizes the bone, which can relieve the pain and help prevent further collapse. More than one fractured vertebra can be treated at the same time if needed. The entire procedure is done with a small incision, and steri strips or a suture will be placed after the tubes are removed. The patient goes home 1 to 2 hours after the procedure when the cement has completely hardened. It's a safe and effective way to address pain and improve mobility for many people who experience these types of fractures. Although some discomfort at the procedure sites is not uncommon after kyphoplasty for limited periods of time, any significant complication is very rare. If you have any concerns, please do not hesitate to discuss these with Dr. Wasserman or his staff. If you are having sedation, you will have the opportunity to discuss anesthesia details with your provider shortly before your procedure. Dr. Wasserman is a board-certified anesthesiologist and can answer most of these questions for you as well. Prior to a kyphoplasty or vertebroplasty procedure, you should have nothing to eat or drink after midnight. You may take your usual blood pressure and pain medications with a sip of water before coming to the procedure facility or our office. Please to be sure to discuss the use of any blood thinners or anti-inflammatory medications with me or my staff, as they need to be discontinued before the procedure and each medication has its own unique requirement. Avoid the use of GLP-1 inhibitor medications for at least 1 week prior to the procedure, as they can cause issues with delayed gastric emptying and anesthesia. Please shower the morning of your procedure and scrub your back with Hibiclens body wash or soap. You will be sore for a few days. Preoperative pain medications can be used as usual, but hopefully can be discontinued within 1 week after the procedure. You may start showering the following day, but avoid standing water, spa, swimming, for at least 2 weeks. Please stay active and begin walking immediately, gradually returning to normal activity over 7 days. You will be scheduled for a post-op visit in 10 days for wound inspection. Thank you for taking the time to view this video. Kyphoplasty and vertebroplasty have been an amazing success for people with compression fractures. These fractures can cause severe pain and limit mobility, but these vertebral cementing procedures are minimally invasive treatments that works wonders. What's remarkable is how quickly patients feel relief, often within a day or two. Most people can quickly get back to their daily activities. It's a safe and effective solution that's truly changing lives for the better. Please do not hesitate to contact us to find out more about these procedures.